However, over the past 7 or 8 years, I also started to work in East Africa. And that was triggered by a summer stay, 2 weeks of volunteering with HVO, the ASH-associated health volunteering overseas organization. So when you practice hematology in those settings, and it's not just about lack of money or lack of funding or politics or economics, it's actually cultural differences as well, the infection environment, the hygiene environment. It teaches you to practice a completely different, a new type of hematology, where the knowledge that, or the practical experience and the exposure that I've had over the last 30 years in my career in the UK, they help me to identify what would be the right management. But at the same time, you have to come up with very new approaches. And I find that very interesting because it's a bilateral collaboration. It's not something where you come, from the global north and you tell people what to do. It's actually something that is very interactive, and where many times over, I realize my colleagues are right and I'm wrong in the approach to patient management. Of course, there's lots of things that in theory could be done, but most of them are political decisions. And as you've probably seen, the political decisions at the moment are going in the opposite direction. So this is a much more complicated problem than just saying, oh, the North needs to give more money. I think what we will see over the next 50 years, slowing down of what happens in the global North and in the global South, things will grow in a chaotic way, and in the end, in 100 years from now, but we will equalize ourselves out. That would be a very positive outcome.
Yeah, it's like a complex web of knots to be untangled, but if we untangle it one by one,
exactly.
Then,
Unfortunately, it's coming down to those to those conclusions, that it's one by one, step by step, things will change.
Welcome to EHA Unplugged, the official podcast channel of the European Hematology Association. I'm your host, Wilson Lim, and today's guest is Professor Anna Schuh. Professor Anna Schuh has won the EHA DEI, Diversity, Equality and Inclusion Award for the EHA 2025 Congress session. And today we'll be talking about Professor Anna Schuh and her work she did behind the award. Good morning, Professor Anna Schuh, and welcome to the podcast. Could you tell us a bit more about yourself?
Yeah, thank you for having me today on this podcast. I'm a professor of molecular diagnostics at the University of Oxford, and I'm also a visiting professor at MUHAS, the Mumbili University of Health and Allied Health Sciences. I've been spending a lot of my career looking and investigating and researching and looking after patients with chronic lymphocytic leukemia. They are mainly older men, and obviously it's the most common leukemia in the Western world. And I've been very privileged to be part of the journey of the development of new therapies for those patients, and looking also at genomics and including whole genome sequencing, trying to identify predictive factors in CLL. However, over the past 7 or 8 years, I also started to work in East Africa. And that was triggered by a summer stay, 2 weeks of volunteering with HVO, the ASH-associated health volunteering overseas organization. And they basically asked me to go to Tanzania because there is a hematology specialization program, an MED program at MUHAS, and they are always looking for teachers. So I went there for a couple of weeks and I taught the students. These are fully qualified doctors and they're going into specialty training for hematology. I taught primarily morphology and bedside teaching. And then, when I got back to Oxford, I started to look for small funds to help establish some of the diagnostics that weren't available in the university there and at the hospital, and then going forward also to start building capacity and allow students to register for master's dissertations that were maybe a little bit more interesting than just doing retrospective case reviews. So that's how it started. I then increasingly felt that there is a huge gap between my practice in the United Kingdom and the practice in East Africa. And I wanted to address this further, and started to apply for programmatic funding in the UK, including global health funding. And I was very fortunate after some unsuccessful attempts looking for funding to improve diagnostics of adult leukemias. I was advised to target childhood disease and infection-related cancers. So I got my group got significant funding from the NIHR, which is the UK equivalent of the NIH, and we developed a program called AI-REAL, which stands for Aggressive Infection-Related East African Lymphoma. And we managed to recruit almost 400 children with suspected lymphoma into a sample collection, data collection study in Uganda, in Lachor, and in Tanzania, in 2 different sites. And that helped a lot with capacity building, because we then had funding for PhD students, we had funding for nurses, for pathology, for even for health economics. So we're able to establish a whole program of work to introduce a tech transfer of liquid biopsies to improve the diagnosis of Burkitt's lymphoma in children around the Great Lakes of Africa, where this disease is still very common.
That's a very interesting background and journey that you've been through. I've realized that I haven't congratulate you on your award, so congratulations. And
Thank you.
how do you feel about receiving this award?
So what I said yesterday in the award session is basically that I don't really see that this award is for me myself. It's kind of for my colleagues in East Africa, but I think predominantly it's actually for the patients. And on my journey, although the program is on the children with Burkitt's lymphoma, it goes much beyond that. So we when I do my ward rounds with students, or I discuss patients in the grand round or in the multidisciplinary team meetings, most of them are adults, of course. And contrary to what people might think, actually, our ward is not full of patients with sickle cell disease. Our ward is full of patients with malignancies. And it's basically raising awareness for the complications, the specific complications of trying to help those patients in resource-restricted environment, be that because of lack of diagnostics. There's very few serum electrophoresis machines in East Africa. The full blood count machines are often not available in primary care, so people don't know in the healthcare how to interpret a full blood count, which means that diseases like chronic myeloid leukemia, CLL are not diagnosed, are diagnosed very late. AML is a huge challenge because dose intensification in sub-Saharan Africa is very difficult because of lack of supportive care, lack of blood transfusions, platelet transfusions, underlying infections like tuberculosis, malaria. And the mortality rate in induction in AML is very, very high. So when you practice hematology in those settings, and it's not just about lack of money or lack of funding or politics or economics, it's actually cultural differences as well, the infection environment, the hygiene environment. It teaches you to practice a completely different, a new type of hematology, where
Mm.
the knowledge that, or the practical experience and the exposure that I've had over the last 30 years in my career in the UK, they help me to identify what would be the right management. But at the same time, you have to come up with very new approaches. And I find that very interesting because it's a bilateral collaboration. It's not something where you come, from the global north and you tell people what to do. It's actually something that is very interactive. And where many times over, I realize my colleagues are right and I'm wrong in the approach to patient management. So the award is dedicated to raise awareness of those patients, and that across the world they still are the majority of patients. I'm not just talking about Africa, because increasingly, of course, we see poverty and also cultural clashes within our communities in the global north. So we can learn from that as well, and we can try and find the right type of treatment that is right for that particular patient by listening to the patient and by listening to the environment of that patient and their values, etc. So it's a very interesting tension that I'm living in, because I spend half of my time in the United Kingdom and half of my time in East Africa. It's quite difficult sometimes because of this cultural tension.
Talking about sort of mutual collaboration and sort of cultural differences, was there anything that you've learned in your experience in Tanzania you could help be implemented in the global north?
There's so many things. I mean, it's part of the tech transfer. Just a very practical example. I had my colleagues, obviously from the United Kingdom, from my lab. They came and they did a lot of teaching in the lab. And what they realized on day one was how mindful people were on resource use, on how you recycle rubbish, plastics, how you can reuse sometimes, how you can think very carefully about when to not reuse it and when to reuse it. In Uganda, in Lachor, which is far in the north of Uganda, it's an old hospital that was originally founded by the Catholic Church, but they managed to get solar panels installed. So the whole hospital, including operating theaters, functions on solar. They don't have throwaway plastics. They're still using linen in operating theaters, and they're ironing it really, at very hot, so that it disinfects even further. There's so many things that I'm not saying we should completely adopt all these things, but being mindful of resource is something that we should really, really embrace. And that's one of the things. I think another aspect, especially in Tanzania, people are very polite and they respect older people a lot. Mm-hmm. So when you come like myself, as a kind of older person, you feel very welcome, and it's not something that is the case in our setting anymore, that older people are always being very welcome. So, when an older person goes to a hospital, you can be sure in Tanzania, you can be sure that, like the whole family turns up, right? And they look after each other in a way that maybe we used to do like 50 years ago, 60 years ago, but there is a very different perception to respecting older people and to embracing death. I find this sometimes very astonishing, but how quickly, people embrace and accept that life is over. And
it's a different sort of empathetic practice,
very different.
Yeah.
And to practice in that environment, I think also requires me to be guided by my colleagues. Like in our setting, 75-year-old, we when they're going through 5 rounds of treatment, after that we offer them CAR T cells, right? And I'm not being ageist, but we have to be mindful of this. And so coming back to when I got my funding for the children, this was in the UK. In an interview room, there were 20 people. They were all public health people, and you walk in there as a hematologist practicing really high-tech medicine. They do not understand why you even apply for global health funding, because for them there's no role of hematology in global health, because global health is all about public health measures, preventative medicine, stuff that is really cheap and has a huge impact. So the way to kind of demonstrate that hematology and bring hematology on the table is by working with children. If you save the life of one child, that's always cost effective in the public health view of the world. This grant is now finished. We are still publishing. We've had already, I think, 8 publications. Some of them are quite high impact journal papers, which I think I'm very proud for my students in Uganda and Tanzania, because it doesn't happen that they're on papers. Usually what happens is that when these helicopter research comes in, people collect samples and they ask really clever questions. They do all the analysis in somewhere in Europe or in the US. And then, if you're lucky as a African, you're being acknowledged, somewhere in the acknowledgements, or you'll be somewhere in the middle, drowned in the paper's authorship. So we wanted to make really clear that this was African-led. So all the first authors are Africans. I did actually resist a lot to be a last author, but that didn't quite work out in the end. So I do find myself as a last author, co-last author. So it's important that people take ownership and that they feel, what the research they're doing, the questions they're asking are relevant to them and to their context. But I primarily supervise students who are on site, and I find that more meaningful, and I think they do as well. So the next idea now is that we finish the publications, and then we would like to run a phase 1, phase 2 study where we vaccinate children with Burkitt's lymphoma. So we have done a lot of sequencing of the EBV strains, and we've developed a vaccine that we think is rather tailored towards Burkitt's lymphoma, together with the Oxford Vaccine Group, who have obviously had a lot of experience during the COVID pandemic in developing vaccines that are stable at room temperature and that can be used in sub-Saharan Africa. Adrian Hill is very much behind many of the vaccine developments, malaria vaccine, etc. So we're piggybacking on the Oxford vaccine program to bring this vaccine to those children after they achieve a remission after chemotherapy. So it's a therapeutic vaccine that we try to evaluate, which will be another 5 years of work, and again, which will bring, funding for capacity building.
You've talked about the people that you've worked with in your journey in several places in Africa. Are there any notable mentions that you would like to talk, people that you would like to talk about?
I don't want to start mentioning any specific names because there's so many. I'm sure I would forget some. I think I definitely had important mentors in my life, and they basically taught me various different things. And I think one of them is to critically think and to be able to interrogate, whether that's science or whether it's what people say, perceptions. I think being pragmatic and opportunistic and jumping on opportunities, I think, is really important, especially when you're doing translational work like this and you're navigating different cultures. You have to be very understanding and empathetic. And I've had mentors over the years who helped me establish that, including also bedside manners and how to be compassionate. It's important that you see it. And I think that's also where I see my role as a mentor now in East Africa. It's to basically lead by example and to give some form of exposure to other people, so that they see, how you approach a patient, how you approach data, how you try to get funding, how you try to establish a laboratory or clinic. So, yeah, I think what I would like to add is that as part of this journey from research, from tech transfer to, publishing papers, to then going really trying to make a sustainable impact, we created a social enterprise that is incorporated in Tanzania. It's called Serenox Africa, from Serengeti and Oxford, and then Africa. Serenox is a clinic and laboratory, and it's a private entity that is completely independent from any public services. But we are working as a public-private partnership with the university and with the National Hospital. It's registered as a mono-specialization clinic, and lab, and it's to our knowledge, the only one in East Africa for patients with blood diseases. So we are very proud, and by we I mean the 8 shareholders who are involved, who are all Tanzanians. We are very proud that we have got this entity now, because we can actually apply and practice all the teachings that the students are learning and the new hematologists are learning. There's 46 hematologists now, and quite a few of them want to continue working as hematologists, obviously, when they finish their training. So the social enterprise is one of the ways how you can make this impact sustainable. In Uganda, we're working with the Ugandan government, and they have allowed us to run a pilot with the help of the Central Public Health Laboratory in Kampala. They're doing liquid biopsy testing for Burkitt lymphoma, and I'm hoping that over time we will be able to integrate the liquid biopsy testing into the existing network of sample referrals that this lab gets, because it's the national lab for Kampala, for HIV testing, for HPV testing, and hepatitis B testing. So we're trying to piggyback onto this network. So that process of making the impact sustainable, it's still ongoing even beyond the end of the program, and I'm hoping like the vaccine study will boost the initiative further.
Is there anything that the Global North can help in this journey for a sustainable impact?
Of course, there's lots of things that in theory could be done, but most of them are political decisions. And as you've probably seen, the political decisions at the moment are going in the opposite direction. So in the UK, for example, global health funding by the NIHR that funded all of this has now been put on hold, and funding has been allocated into the defense budget instead. So it's a very tricky environment we operate in. There are lots of rich people in Africa, and philanthropy is not on their agenda.
Oh, wow.
And that is also an issue. And it's the same in India. It's the same in many other, in South America. So this is a much more complicated problem than just saying, oh, the North needs to give more money. I think what we will see over the next 50 years, slowing down of what happens in the global North, and in the global South, things will grow in a chaotic way. And in the end, in 100 years from now, but we will equalize ourselves out. That would be a very positive outcome. There's lots of catastrophic outcomes that we can imagine as well. But we are in this transition phase, and it's very unpredictable. So my conclusion of all of this has been that, yes, I'm raising awareness, and I'm trying to do what I can do in my little world. And then over time, maybe there's, others would think, yeah, actually, she's not completely wrong. Maybe we should do the same.
Yeah, it's like a complex web of knots to be untangled. But if we untangle it one by one,
Exactly.
then
Unfortunately, it's coming down to those to those conclusions, that it's one by one, step by step, things will change.
Last question. Do you have any advice for people that would like to do the same as what you did?
Yeah, so I'm very, very privileged because I had a career and I still have a career in Oxford, and I'm eternally grateful for the University of Oxford and my head of department that they're allowing me to do the work I'm doing. If you are starting off as a junior hematologist and you want to work in global health, it's very, very interesting, but it's very, very tough because also you're kind of in that phase where you would be possibly competing with people in the country. And so can't be, right? Because, ultimately the goal has to be that you promote them rather than yourself. So it's very difficult, I think. Obviously, the traditional public health type, infectious disease type, global health type work, there were careers in that. I don't want to be negative, but it's a little bit exploitative, coming back to the helicopter research.
Yep.
So even although the individuals might be very well-meaning, ultimately the system encourages that type of research where you just take the samples and you do your stuff, right? So you then have the other extreme where you have people after they retired, they go and they help and they do some global health work. And I think that's really good as well. They obviously have a lot of experience. I think the problem with that is that sometimes people then try and implement something that was the trend 20 years in our setting, whereas what Africa needs is leapfrogging.
Yeah.
Africa is like the mobile phone. Everybody quotes that as the example. So, the landline never worked in Africa, but the mobile phone is much more advanced in Africa than it is in our setting. So I do all my banking, pay electric bills, whatever. Everything can be done by the via mobile phone. Out of the 66 million Tanzanians, 45 million have access to a smartphone. This is very important. That's leapfrogging is one. So rather than saying, we're now doing myeloperoxidase to look for AML, no, actually you have to say we do next generation sequencing to do genomic subclassification, because you have to leapfrog from where we were 20 years ago to where we will be, where Europe or what science will be in 10 years from now. That would make Africa internationally competitive. Right. And and that's just in our little world of hematology. And I think when you're 70 plus retired, it's more difficult because you can't get grants. You will have that reflex of getting back to what was fashionable, when you were a youngster. So that's why I'm saying I'm very privileged, because I was allowed to do this at sort of through my 80% through my career, but I'm still full-time employed by University of Oxford, so I can tap into the money that and the grants and everything that are available, and I've got a little bit of clout, so that people, when I'm saying I want to do something, they think, yeah, okay, she can probably do it. But it's also the time, of course, when nobody wants to do this, because it's a time where most people my age, they say, actually, much rather retire, and I've got kids at university, I've got so much money I spend on other things, it's not for me.
Yeah.
At this point in my, if there's something that could be done, is get people who are senior consultants in hematology, get them to spend 6 months to a year somewhere else.
That's a very good advice.
If they come back things will change.
Well, I'm glad that we've heard that you've given us such a good story about your experience and your thought about situations, global situations, and things that's going on at the moment. We'd like to thank you for your time. Thank you again. And we'd also like to thank the audience for listening. Again, congratulations on your award,
Thank
Dr.
you.
Schuh.
Thank you very much, Vincent.
Thank you for your time. For all our listeners out there, please stay tuned for more episodes from EHA Unplugged, the official podcast channel of the European Hematology Association. Thank you.